Bariatric surgery is a weight loss surgery. Bariatric is a Greek word which means baros, means weight. So it's basically a weight loss surgery. It started more than 30 years ago. In India, this surgery started about 8 years back, and that was the time when we started this surgery in our hospital, Jammu, Jalandhar. Under bariatric surgery, we do various types of surgeries. The most common is Roux-en-Y gastric bypass. This is a time-tested surgery, started more than 30 years ago. In this surgery, in Roux-en-Y gastric bypass, two things are done. Number one, we reduce the size of stomach to 1/4 using staplers. It's all done laparoscopically, there is no cuts, just the surgery is done with 4 holes. The second thing is we bypass some part of your intestines, that is duodenum and jejunum, and about 150 centimeters of this small intestine is bypassed. And the principle of this surgery is that you burn more calories and you consume less calories. There are two things done. The first, reduction in the size of stomach will help you to eat less food so that you don't feel hungry after eating even small quantity of food. You feel full. The second thing, when we bypass that your duodenum and jejunum, the absorption of food decreases. So whatever you eat, the absorption of food has decreased. So these two things in turn will help you in reducing your weight about 3 to 4 kilograms every month. Plus, it will help you to correct your type 2 diabetic status. Even if you don't take your oral anti-diabetics or insulin, your diabetes will still be controlled. Of course, it should be type 2 diabetics. Another benefit is your high cholesterol, your high triglycerides, they also settle down with time. Then your joint pains. And most of the obese patients have a very common problem, that is snoring. Snoring in turn leads to sleep apnea. Sleep apnea means that your oxygen level during sleep decreases. And there's more of carbon dioxide in your brain, which is very harmful. So after this surgery, when you lose your weight, your sleep apnea, snoring will decrease, and within few weeks they almost end, making you sleep very comfortably. Even you can stop using your CPAPs. Another thing, your joint pains because of overweight, they also go away. The quality of life after bariatric surgery improves a lot. I've seen patients who are not able to move more than few steps before surgery, and 6 to 8 months after surgery, they are so active professionally, they are so active socially, they live a new seed of life. The quality of life improves tremendously. Another upcoming procedure in bariatric surgery is a gastric sleeve resection. Gastric sleeve resection is more suitable for those patients who are only obese because it helps in reducing weight, and up to some extent it also resolves your type 2 diabetic status. For young patients, we do gastric banding. In gastric band, we wrap a band sort of thing around your stomach and tighten it so that you eat less. But as I said, the gold standard is gastric bypass. That is a time-tested procedure.